In this video, we're going to be talking about the knee joint and knee pain. Now, the knee is a pretty complicated joint of the body, and 50% of the population at some point is going to have some knee pain. Probably because of an injury like a strain or strain, probably because of overuse that can develop to osteoarthritis, or underuse that can develop to osteoarthritis. Now, the knee right here is composed of the femur, the tibia, you have the fibula right here on the side, and then you have the patella. But in the knee joint is mainly the femur and the tibia, the patella, and there's a lot of ligaments, tendons, cartilage, muscles that attach to the knee to bring the mobility and as a shock absorber like the meniscus. Now, this joint is a hinge joint, so it's mainly flex and extends. So flexion, extension. Right? There's a little bit of rotation, not too much, but there's a little bit of rotation so you can pivot. But if you overdo that rotation, that can lead to injuries on the meniscus or the anterior cruciate ligament, the ACL. Now, there's a lot of common conditions that I see here in my clinic that will develop into knee pain. And the first one is osteoarthritis. In osteoarthritis, what we see a lot is people that have had an old injury. Let's say they were athletes and they used to play rugby or football. They do a lot of rotation, changes of direction, a lot of kicking, and they develop some injuries. And if you don't rehab those injuries correctly, that will lead to degenerative changes on the cartilage of the knee, and that will lead to pain. So osteoarthritis is when the cartilage of the knee starts to erode, start to have degenerative changes on those cartilage, and now the bones are rubbing against each other, and that will cause inflammation and pain. On the same time, you have people that don't use their knees a lot, they're always sitting, they don't move, they develop stiffness, and that can lead to osteoarthritis as well. So one of the best things to do when you have osteoarthritis is develop a corrective exercise program to improve the mobility and decrease the imbalances on the knees. Another common knee pain condition that I see is iliotibial band syndrome, IT band syndrome. This is a muscle that goes from your hip right here and goes down to the knee on that side, and you develop pain on the lateral side of the knee around that area. That happens a lot in runners or people that overuse that muscle and they don't have a proper stretching and mobility routine, and people that just sit for long hours and the muscles are shorter, and that will develop too as well to muscle imbalances. Another common condition that I see is patellar syndrome, right? Patellofemoral syndrome right here, and this is a condition in which the patella, this bone right here, is not passing to the groove and it's not moving correctly. So you have the femur here, you have the tibia, you have the patella, there's a tendon, and there's another tendon. In this condition, the patella is not passing to the groove that the femur has, and now it's starting to rub against other anatomy, like other bones, ligaments, and cartilage around that area, and that will lead to inflammation. That is most of the time an alignment problem, and I will explain later on why that happens. Another common condition is ACL injuries or meniscus injuries. Right? Now, those are mainly because of trauma or you did a change of direction very quickly and you injure the ACL. So the ACL is the anterior cruciate ligament. This is a ligament that prevents the joint from moving forward, so the knee to move forward. And that happens when, let's say, you're running and you change directions, boom, the ligament just went. Same thing happens with the meniscus. Changes of direction or too much compression that can lead to injury. Now, in these two injuries, ACL injuries and meniscus injuries, usually you have to do a surgery. If the ligament is completely torn and if the meniscus is torn, then you might need a surgery. But in the other conditions of the knee, most of the time, surgery should be the last resort, and you can decrease the pain, improve the condition without any surgeries. So you can do some rehabilitation exercises and alignment of the body. Now, Things that are really important when you have knee pain, you just don't look at the knee. Huh? The knee is the problem. This is where you're having the symptoms. But the problem might be coming from the pelvis, might be coming from the hip, or might be even coming from the ankle. If you have poor dorsiflexion, so this is plantar flexion, this is dorsiflexion. If you have poor dorsiflexion, you're going to put strain on your knee because you're going to hyperextend the knee too much, right? So it's important to have proper dorsiflexion of the knee. Same thing, if you have a collapsed arch on the foot, your knee is going now to go medially, and that can start to put more pressure on the medial meniscus and the medial ligament of the knee. Same thing, if you have one side of the pelvis that is higher than the other one, you're going to be bending your pelvis, you're going to be bending your lumbar spine, and the knee is going to collapse in, and the arch of the foot is going to collapse in, and that's going to cause the same condition. So whenever you have a knee pain or knee injury, you have to look at the body as a whole. You just don't treat the knee and pray that the pain is going to go away. You have to see what's the pattern of movement, if you have any imbalances on the knee, and how you can treat those holistically so you can have better results. Now I'm going to teach you some exercises that you can do to improve the movement of your knee and reduce the pain. The first one is going to be to strengthen the knee. So you're going to sit down on the floor, straighten your leg, and you're going to contract this muscle right here, the quad. So contract the muscle, put tension in it, and hold that contraction for 5 seconds, and then relax. This is an isometric exercise. That means that there's not movement of the joint, but there is contraction of the muscle. So contract that, 5 seconds, and relax. After that, you're going to do the straight leg raise. So from there, you're going to lift the leg, hold it 1-2 seconds, and then go down. And it's good that you dorsiflex the ankle at the same time. Go up, 1, 2, 3, and go down. You're gonna feel this right here on the quad and the hip flexor. Try to do at least 10 repetitions inside 3 times, so 3 sets. Another one that you can do is a little bit of extension of the knee. So you can put this here, you're going to have the knee from flexion, and then just extend the knee. And you can do, again, 10 or 15 of those, 3 sets in each side. Another good exercise that you can do is to lay down on your side, and this is going to be mainly for the abductors of the knee. So we're going to go up like that. Keep the knee straight, go as high as you can. Do 10 in each side. You're going to be strengthening now the adductors of the knee, the side of this area. Another thing that you can use to strengthen your knees is this right here. So you're going to lay down on the floor and you're going to do bridges. So really simple to do. You just put your knees bent, right? And put the foot close to your buttocks, like a hand away, right? Not too far, not here, not too far either, so around a hand. And now you're going to bring the pelvis up. At the end of the movement, squeeze your glutes and then go down. And then go down, okay? Do again 3 sets of 10 repetitions. If that's too easy for you, try it with one leg. Just straighten one knee and then lift with one leg and then go down. Okay, then try the other side and go down. Pretty simple exercises to do. One more that I'm going to teach you. You will probably need one of this if you can get them. This is a Pilates ring. And with this, you're going to work on the inside of the knee, so the adductors. So you squeeze and then let it go. Squeeze, I actually like to hold that for at least 1, 2, 3, and then go up. So you can use that. Now, to stretch muscles around the knee. You can grab a towel, a rope, strap, anything. And then you're going to stretch the hamstring. Now to stretch the hamstring, the best thing to do is you lay down facing up. You bend one knee, try to flatten out the back, and then bring the leg. Now, don't bend the knee. If you bend the knee, you're not doing anything. So keep that knee straight. You can put one hand here and then hold with the other one. And hold that 30, 20 seconds. And then go to the other side. With each stretch, try to go a little bit farther away. You should be able to go at least 90 degrees with this stretch. Another one that you can do, this is going to be now for the quads. So it's the opposite. Here, it's a little bit more difficult, but you will get the idea. You lay down and you just bring the knee into flexion. By doing that, I'm stretching my quad as well. Again, stretches is better to hold 30, 20 seconds, and you get the idea right there. Or tools that you can use to stretch the muscles that are too tight is going to be a muscle roller. So with this, simple to use. You can find this in most of the sports stores. This is really cheap. This is probably $10. And you're going to roll on the area, putting pressure. Whenever you find a sore spot, this is where you want to focus. If you have iliotibial band syndrome, so IT band syndrome, this is the muscle that goes from here and attaches to the knee. You probably have pain on the knee. This is pretty common in runners. This is really good to use. You can do that. If you have patellofemoral syndrome, you can now go on the quads as well. You go obviously on the inside as well. Another thing that you can use for that is a foam roller. This is the most difficult of all, the most, because you have to have control of the body. You have to know how to do that, and you need to have a bit of strength to do it. And this sometimes hurts a lot, but it's really good to do. So let's say I have pain on this area, so I'm going to put the hip on the roll. I'm going to stretch my leg. I'm going to put the other leg here, and I'm just going to roll up and down, looking for those sore spots. Whenever I find a sore spot, this is where I want to focus my rolling, and then look for another one. Then you put the roll a little bit lower, and you go to the knee. That's how you roll on the side, so the IT band. You want to roll too on your glute, so sit on the roll, bring the leg like this on a figure 4, and then you roll right there. One of the most common mistakes that people do that is that they put the weight on the other side. And I want you to put the weight on the leg that you have bent, okay? So key in doing that. The other one is you're going to roll on your quad. So lay down, facing down, and then you roll on the quad, and then you can even roll a bit on the medial side of the leg for the adductors. Now, as you see, this takes a little bit of effort. The easiest way to do this, and the most effective way, is to get a gun, massage gun. Massage guns are easier for you to control. They go into spots that you cannot go with the roller, that you cannot go with this right here. And you can increase the speed or decrease the speed, and then go in there on the muscles. I usually use this hydragun. Really good, really strong gun. I can leave a link below in the description so you can check the gun out. At least 2 minutes in each group of muscle, and then do the other side as well. So those are some stretches and exercises that you can do to improve the mobility, with the strength, and stretch the muscles that are too tight. So I'm going to try the knee massager now. I'm going to put it on my right knee. Obviously, you don't want to put it too tight because you don't want to stop circulation. You're going to put this part right there. To turn it on, you're going to press for 3 seconds on this on and off button. You can increase the heat, so I'm going to put 50. And then to start the massage, you're going to hit the M button. Really good. I feel heating it up and I feel a massage on the knee. This is really good for people that have knee pain, to improve the mobility of the knee. You need to warm it up, move a bit. So this is a good deep massage and good heat for that. So definitely I'm going to be using it on my patients and on myself whenever I have knee pain. So really good product by Hydragun. So